The minority in Parliament is urging government to immediately resolve concerns of medical staff at the Kolebu Teaching Hospital, for which they are threatening to withdraw their service over a coronavirus scare. Minority spokesperson on health, Kwabena Mensah Akando, told a media briefing in Parliament it's shocking that despite repeated assurances by government, frontline medical staff still lack PPEs.
We were shocked to hear yesterday that some medical doctors at Kolebu Teaching Hospital are threatening strike actions. I believe that at this point in time, in this crisis, the least that we want to hear as Ghanaians is to hear that any health professional is threatening a strike action. We have taken time to read through some of their concerns, and we think that they have legitimate concerns that we think government, as a matter of urgency, must respond to, because at this point in time, apart from God, they are our saviors, and so we must be able to protect them as much as possible, to have the confidence to protect the citizenry. So some of the issues they raised were about the inadequate PPEs in the system, and we think that they must be fully protected as health professionals before they will be able to save lives. And we are reliably informed that we have some PPEs in the system. So as a matter of urgency, we think that these PPEs must be distributed, especially when we have heard instances where medical doctors and some health professionals are contracting the disease as a result of saving lives. A typical example is the Lekma situation and the Rage Hospital situation. So I think it is legitimate that they call on government to protect them adequately as they fight to protect the citizenry. Again, I think that for some time now, government has been doing a lot of talking, and we think that it must be backed by real actions. The action is not there. You go to almost every region and health facilities are complaining of PPEs. A typical example is a memo that has leaked out from the Eastern region. In Eastern region, I think maximum one facility has been taken from each district, and even the PPEs that has been sent to those places are woefully inadequate. And so I think that government, as a matter of urgency, must distribute some of these PPEs so that they can get the confidence they deserve to be able to fight this particular disease. Again, they also complain about the flow of information, that sometimes they go beyond 24 hours before they hear that a patient that a medical doctor, a health professional has attended to has tested positive or negative. They are of the opinion that they must be the first people to get information whether a patient has tested negative or positive, so that they will be able to take the necessary precautionary measures. And so the opaque manner in which they are managing information should, at this point in time, be very, very transparent, so that the medical doctors or the front-line health workers will take the necessary precautionary measures. Let me take this opportunity to also commend corporate Ghana for the donations they have done so far. I appreciate so much.
Joseph Opoku-Gakpo joins us live via Skype from Parliament with more. Now, Joseph, what was the reaction to this call from the minority on the floor?
Well, this is a conversation that's essentially been happening outside Parliament itself. Speaking of the chamber, on the floor itself, nothing relating to COVID-19 has come up. But those on the majority side make the argument that government is putting in place the necessary measures. These are difficult times, and that it will take time for things to smoothen up. And so government deserves all the necessary support that's required in order to be able to help the nation deal with the problem.
Some officials of Parliament, Joseph, have come under criticism from medical staff who say they don't get these PPEs in short supply whilst members of Parliament use them. Has this come up in your conversation with these MPs?
Specifically relating to PPE, what MPs have done is on their own. They say they would procure, get it imported, and go hand over to people in their constituencies, like someone like Samuel Okudzeto Blakwa has done, as far as I know. But the MPs just make the point that they are supporting as much as they can. Government is supposed to take the front lead in terms of providing the necessary resources. The best that they can do is to probably just add up something little in terms of maybe limited PPEs, probably hand sanitizers, and other motivation that they can give to their health staff, which, according to the MPs, they've been doing.
So, Joseph, take us through the other activities that have come up on the floor.
This morning, the House is approving a loan facility to help with the construction of a harbour at Elmina. And there are a number of other items on the table, including various loan facilities to help provide for a number of hospitals. A little later in the day, two things are expected. You recall that about a month ago, government laid before Parliament a request for a supplementary appropriation as far as the 2019 budget is concerned, because government has spent more than 6.9 billion cedis in the oil sector that they're seeking approval for. That will be debated a little later in the day and probably passed. And the expectation is that the finance minister will be around to guide the House to do that. And additionally, the House is also expecting what is described as the coronavirus alleviation program, the stimulus package that ranging in the region of about $1 billion Ghana cedis in order to support businesses and all. That's also a document that the House is expecting to be laid later in the day for them to deal with throughout the rest of the day and tomorrow, because they're going on an indefinite break by close of business report.
Thank you, Joseph Opoku-Gakpo, for bringing us those updates from the floor. We move to other issues.